When you think about your experiences trying to access healthcare, what comes to mind?
It's very hard to access healthcare. I think it's hard in general. I think our system is broken for pretty much everyone. But the amount of additional layers that come when you have, and in a way, any type of disability, just it makes it truly a monumental problem.
When you think about your experience trying to access healthcare, what comes to mind?
Um, this is going to be kind of a bummer of a conversation. So here's a content warning because I don't have a whole lot of really great healthcare experiences. I have medical PTSD. So when I think of the healthcare experiences that I've had, a lot of them have been very challenging, particularly from communications perspectives, trying to make myself understood to the doctor and being understood.
What comes to mind is a doctor or physician or the nurse, willing to understand that this individual is different than all the others, and how can he or she adapt to that individual needs. But with me, it's more about, will this doctor, nurse, physician accept me for who I am, not what I am.
Obviously been autistic my whole life, but I didn't know I was autistic. So I never knew what the challenge was. When I think about myself, even as like a little child and someone had to put attention on me or had to touch me in any way, I think I had a real fear response that I'm just starting to really start recognizing. And I didn't always felt like I was asked permission. And that I realize in retrospect is huge. So I kind of didn't access healthcare, or accessed it very, very minimally.
Even in emergency rooms, like not being able to tolerate the environment and being, potentially written down as an uncooperative patient because I had to leave before they were done with their stuff because I just couldn't tolerate it.
What are some challenges that you've faced in accessing healthcare?
The challenges that I face accessing healthcare is the accessibility formats, documentations that they give you, new patients or existing patients, forms that you have to fill out per meeting or pre-form meetings when you get there for your doctor appointment that day, which is, is not accessible.
It was very anxiety producing for me. The thing that I think is like what I've recognized, even in like a basic wellness exam, there wasn't a connection. I didn't have a connection to my body, and I didn't have a connection to understanding why the question was being asked. So if I went to a wellness exam and they're like, tell me about your teeth, and I would just be like, I don't know how. And because I'd be so anxious, I don't think I had access like to my fully functioning, like speaking. I just wouldn't know what to say.
Nobody believes you. And then there are different levels of that in, you look at it wrong, or you couldn't possibly know yourself because you're this subgroup or that subgroup. And then there are the ones where, everybody looks fine, so it has to be fine. And I found out a lot as a parent that I would know something was wrong, but my kids didn't look disabled. Oh, they looked cute and perfect and just the right amount of chubby. But no, I'm just one of those moms.
Yes, the difficulty healthcare system for me was the physicians of trying to understand my complexity of my learning knowledge and how I learn and how can they adapt to my learning. for me, it's more about, not only speaking to them on that same level, which is very, very tricky, but also complexity of the healthcare system in itself, because they're running on the medical terminology of the healthcare college insight. And when they use those or explain those to patients, sometimes patients like myself with disabilities cannot get it, because it's like you're teaching a seminar at a university, but you're doing it with a patient.
Well, she has staring spells. Well, she can walk a straight line and touch her nose, so there couldn't possibly be any neurological difficulties. And it's coming from otherwise knowledgeable people. You start to wonder, where is the problem? I have spent a lot of time not getting a lot of things. And part of it was, well, maybe this is just something maybe I am wrong. Maybe there's this big cosmic thing that 95% of the populace gets and I don't get because I'm me and I don't get it. And I didn't know why I didn't get it then, but I just knew I didn't get it.
Right.
But no, it wasn't me this time.
A lot of different symptoms show up in the different systems of the body that were fundamentally neurologically related.
Long COVID, and other, medical issues like asthma. It's very common, but it's also things that should never be ignored in the medical profession field, because those could complicate, the lifespan of an autistic adult or child.
Even though I talked with them about the other symptoms of the autism, my symptoms were brushed off as PTSD.
And I can just feel when I walk in, I don't know if it's a safe space for me. And I don't know that it's like a safe space for me, like being neurodivergent, but I also don't know if it's a safe space because of the way that I'm going to be treated and disregarded in terms of like, just go lose weight. I'm terrified to go. I think there's a lot of assumptions being a fat person. And so like if I go get my blood pressure checked or something like that, there's this like quality of, oh, I can't believe that you have normal blood pressure. Like just like the things that people are saying to me, I just recently had a routine mammogram, and like what was said to me during that appointment was incredibly inappropriate.
When I came to Vermont and, I moved here, so you had to get a new medical home, this old country doctor, nice man otherwise, took a look at me, weighed me, and signed me up for like the entire list of every health test you could possibly have. And I'm like, I don't really want to pay for all these, but okay. And then I was like, no, we don't need to do the cholesterol. At least I know that one is fine, because I'd had it done recently and I inherited low cholesterol from my dad. And he wouldn't believe me. So we ran the test. And my cholesterol actually had gone up. And I said, well, should we worry? Because it's gone up 6 points in a year. That's the most it's ever gone up. And he told me to be quiet. And I was like, okay. And I couldn't really voice anything back for me because we're trained not to do that.
Well, how is your menstrual cycle? And I was like, fine, great. Well, when was your last cycle or whatever? And it was like, I have no idea. And I immediately like was yelled at. And what they said to me was, I think of, and I started crying, and they said to me that it's my job. Like, I always think it's a good sign when people are crying, because it's my job to make sure. And if I have to yell at people to make sure that they're taking care of their health.
Going through that time period was super frustrating, trying to get attention and going to all these different specialists and not getting a whole lot of answers. So many of these experiences are me advocating for what I need. It took me 5 years to get a diagnosis for my autism.
My healthcare provider said, well, we can't say you're autistic. Or like, you know, like my chiropractic care was like, no, there's just no way. Like, just like not asking me, not curious at all. Like not saying why, what makes you think that you're autistic, or how could we find you an autistic specialist to figure out, or
to give you some idea how powerful it was. Number one, learning that I was autistic was like a kaleidoscope coming into focus for my entire life that made everything make sense. And I was also diabetic at the time. My blood sugars literally dropped 20 points overnight and stayed down with the self-diagnosis of autism.
I find that hypocrisy bothers me a great deal in general. And, you know, we're supposedly, you know, a society where we're supposed to take care of ourselves and be informed and make decisions and be self-actualized and everything. And even if you're all those things, and in many ways, if you are those things, healthcare isn't designed to work for you. You know, it's sort of designed for you show up and they send you places and put you in little cubbies and folders. And if you actually are like, no, that doesn't actually affect me. This over here affects me. Nobody quite knows what to do with you.
Doctors, I don't think, are really taught how to work with patients who don't fit the expectations of, you know, what the profile is. They're trained to make decisions in a very specific way. They need to, in order to be really good with their time.
Because nobody else lives in your body but you.
Right. Right.
So you would think after a certain amount of time, you would become an expert in it.
Yeah.
I mean, that's kind of how I look at mine.
Yeah. Thanks.
Knowing that just because somebody shows up in front of you and may appear normalish enough, but there needs to be given some amount of space or grace to allow for the fact that maybe this person has other things going on that you don't know about.
I try very hard to communicate, but then when I get frustrated, I become very blunt. And the new doctor I have, he at least can deal with that.
Mm.
But a lot of people in healthcare are still sort of trained in that, you know, I am in charge and you are here at my whim sort of thing. And, you know, we must be respectful. There's so many different layers of those nuances that I'm like, no, I had to wait 45 minutes for you.
I could never go back. So in that one moment, and I went to therapy, and like we're starting to get all these strategies of how do I go back. And that's when I found ABB.
I was going through another round of low mood and fatigue and sort of growing hopelessness about the possibility of having a future. And I had pretty much exhausted mainstream healthcare options, or at least the mainstream healthcare options I was willing to try. And I heard this, I was sitting with this friend over coffee, who was the director of the Vermont Disability Council, and she was raving about this new doctor in Montpelier who was out as autistic and starting a medical practice. So,
what do you wish healthcare providers knew about neurodiversity and neurodivergence?
It's really like, I want them to know about ABB. I want them to know what Mel has figured out. I want them to know this connection between all of the things, that I wasn't waking up in the middle of the night with panic attacks. I was waking up because I wasn't breathing because I needed a sleep study. I was waking up because I have dysautonomia, because my autonomic nervous system doesn't work correctly. Everyone was putting this on me, that like my thoughts were causing these panic attacks. Like, I don't know who has panic attacks. I wasn't having a thought in the middle of the night. And the way in which Mel has reframed that it's my fault, that I'm not doing something correctly, that I'm broken, which is, I feel like what the healthcare would say, like, you're not doing enough. And what I hear Mel saying is, no, the medical system isn't doing enough for you. And so that's what I would love to say, is that if the medical care system didn't blame people who have difference, that instead was curious about that.
And we have made some, not enough, but some progress over the last 40 years, learning to accept people a little bit, to give people a little bit more grace, a little bit more space to be themselves when we can tell they need it. But if you look like you should fit, and then you don't, people get cranky. And if the cranky people are the people that we're relying on to give us the referral, to actually listen, to think about what we're saying and try and put the pieces together in the areas that we aren't knowledgeable about, because nobody can know all of this stuff. Mm-hmm. And if they're just grumpy because we don't fit what they think, no.
For me, I see this, process of the healthcare industry is starting to come around and understand neurodivergent individuals and neurodiversity.
Having curiosity around my experience, like asking me, do I understand where the question is coming from? Providing a space that I can feel comfortable in and safe in, helping me make connections back to myself, not making presumptions about my body, but asking me if like that makes sense. Finding ABV is just like, I've said this to Mel, I've said this to a lot of other people, but it's like, I just know I'm going to live longer. I can't imagine being yelled at. I can't imagine like not being cared for. I think the whole first wellness visit that I had with Sierra, I think I bawled the entire, like I just remember like my shirt being all wet because I just couldn't believe the care that I was getting. And I couldn't believe the access, and I didn't even know what I needed. I had zero idea. That there was all these different options. And so it's just so radically different for me.
The idea that we can just say, this is my access need. And if we can take that step to say, okay, we're going to actually look at this problem. What is the actual problem with access? What is the actual problem with communication? What is the actual problem with coverage? Oh, then maybe we can fix some of this shit. So I think that's what we need.
What I want providers to do across Vermont statewide is to understand the individual needs. If we can understand your needs, we need to be respected in the same way. And for me, it's more about, having that, having that work individual participant relationship. Basically, you want the doctor to get to know you better, vice versa, the patient should get to know the doctor better. It helps move things along quicker and make the process more easy for both parties, the doctor, the nurse, and the physician at large. Plus, the individual patient would feel at ease, of coming back to those services.
So I did the intake, which invited me, and then That invited me to share, like, among other things, what I care about, and also offered to have a provider spend time discussing things I cared about, which really impressed me, and among other things, like the possibility of sort of like, how do you structure an appointment in a way that it's comfortable to you and you feel comfortable. And I thought, things I had never thought about as even possibilities of sitting in a doctor's chair with, a comfortable blanket, or, pillows, or, something like that, so that was like, oh, I could, and so that it was just nice that people thought about things like that. Mm-hmm. And then I was sitting, when I was sitting in the waiting room for my first appointment, there was this, a really short book written for kids. And it basically told my life story of losing it. I remember reading it, waiting for my first appointment. So sort of losing it and having these public meltdowns that I was so ashamed of. And it explained those things in terms of the fight-flight response, which I was totally on board with already. So, and then there was also something on the wall in the office about polyvagal theory, which I was also totally on board with already, and thought, and was impressed that ABB knew about and was thinking about. And so at that point I thought, wow, it looks like these people speak my language.
And what I want to see forward is, that sense of belonging within the healthcare field industry, but also understand everybody's access need is different. We're all different. We're not the same. And for me, it's more about trying to connect, have that universal connection between each industry or each systems, and try to make it a collaborative system where it's cost effective and more efficient, because everybody wins that way if it's more collective than having these barriers, or what you call silos, that are preventing us from providing those services in the first place.
And then this is like a sincere attempt, a really sincere attempt, the most sincerest attempt I've ever seen in a medical practice to meet people where they are at, to serve everybody well, and to leave nobody behind. It's an incredible effort to make groups and meetings and medical care accessible and interpersonally, practically, financially. There's and I love that the practice is really developed in consultation with patients, and like, we're in these advisory groups and invited to join them, and that what happens in the practice after that is how the practice develops is informed and driven by what we say in those meetings, and basically informed and driven by patient needs.
I just didn't know that I would make it. And so when I say, like, I know I'll live a longer life, it's not only do I live a longer life because I have the healthcare, but now I have community, I'm making friends. I feel understood. I feel like all of the things that seemed so isolated in the issues with my health are now understood with very simple medications. It's like, it just changed my relationship to being able to get up in the morning. It's like limited my limbic response so that I actually can be here right now speaking to you. All of these things that ABB are providing for me. And then it's like the other patients are just, I learned so much.
This is just like so amazing to me. There are these amazing group medical visits where Mel and Sierra offer this cutting edge information, but they also allow lots of time for questions and in-depth discussion around areas the areas that concern us. And and beyond that, and there's more, because there's also an opportunity to meet others in the community who are going through the same or similar things, which then gives us the opportunity to learn from each other's experiences, and to really value and feel valued by each other, and feel a lot less alone and a lot more hopeful.